Hi, I'm Spencer. This is my patient, Justin. I have my equipment, and we are going to do the head-to-toe assessment. Okay. So first, I'm going to wash my hands, and I'm going to close the privacy curtain. Then I'm going to introduce myself to my patient. Hi, my name is Spencer. I'm your nursing student for today. I'm going to be doing a head-to-toe assessment, and what that means is I'm going to be just doing assessment head to toe. So if you have any questions, please stop me and ask them, okay?
Okay.
Before I get started, I need to get your name and date of birth so I can identify you.
Justin Wyke, 12/23/1993.
Okay, let me check your wristband, and that matches, so perfect. Are you in any pain today?
No.
Okay, so if my patient was in pain, I would use the Coulter method, which is characteristic, onset, location, duration, exasperation, radiation, and relief. Okay, so you already told me that your name and date of birth, so you are oriented to person. Can you tell me what month it is?
It's May.
Can you tell me where you are?
I'm in the hospital.
And can you tell me why you're here?
I'm here to help you.
Okay, so my patient is oriented ×4 to person, time, place, and situation. I can see that you are also calm and cooperative with my assessment, and sorry, his phone's ringing, and we're good to go.
Yeah, we're good.
All right, so next, do you wear any hearing aids, or do you have any trouble hearing?
No.
Do you wear contacts or any glasses?
No.
No? Okay. So next, I see that your eyes, there's the external part of your eyes. I'm just going to assess them. There's no discharge. Your eyes are symmetrical. The hair on your eyelashes and eyebrows is evenly distributed. Next, I'm going to get my pen light and check for pupillary responses. So I'm going to dim the lights and assess your pupils, okay?
Mm-hmm.
Perfect. So my patient's pupils are round, equal, and they are brisk. Next, I'm going to check for accommodation. So you're just going to look at my pen light, okay? My patient's eyes cross, which is normal, so they're accommodating. All right, next I will inspect for extraocular movements. So I'm going to assess cranial nerve 3, 4, and 5, and that is the ocular motor, trochlear, and abductions cranial nerves. So I'm going to use the STAR method with my pen light, and my patient will just follow the pen without moving your eyes, okay? Perfect. Okay, so I made sure to stop in the middle for each time I was going in the STAR direction. Okay, so that's good. Next, I will inspect your nostrils with my pen light. So you're just going to look up, and I'll shine this in your nostrils, and then, okay. That's disgusting.
Look healthy?
Yeah, okay. And next, you're going to just close one nostril at a time, and I'll look, okay? And I wouldn't tell the patient that his nose... I wouldn't have said that, okay? I wouldn't have said the nose was great. Okay. Close one nose at a time, nostril at a time. Breathe in, great. I'm looking for any obstructions. Make sure your airflow is good, which it is, so perfect. All right, next I'm going to assess your mouth, your teeth, your lips, your oral mucosa. So your lips are pink and they're healthy. Can you open your mouth, please? Perfect. Your oral mucosa is pink and moist. It's not dry. There's no lesions around the mouth, and you're not missing any teeth. And your tongue has no cuts on it as well, so we are good. So thank you. You can close your mouth. Next, I will assess cranial nerve 9, which is the glossopharyngeal nerve. You're going to stick out your tongue and say, ah, and I'm going to look into your mouth with my pen light to make sure your palate raises evenly, okay? Stick your tongue out and say ah. Perfect. So his palate is raises evenly, and that's great. All right, so next I would test cranial nerve 10, which is the vagus nerve. I would stick a tongue decompressor on his tongue for the gag reflex, but I won't be doing that to you today, okay? So we're good to go. All right, next I will inspect cranial nerve 11, which is the spinal accessory nerve. So I'm going to put my hands on your shoulders, and you're just going to shrug your shoulders against resistance, okay? So just try to shrug your shoulders against my hands. Perfect. Okay. Next, I'm going to put one hand on your cheek, and you're just going to go towards my hand against resistance, okay? Perfect. Okay, so his cranial nerve 11 is intact. Okay, awesome. Next, I will put my patient, I would put him at a 45-degree angle to check his jugular vein distension, but I don't have the ability to do that. So, but I would be checking my patient next for jugular vein distension in a 45-degree angle. All right, next, I think I need to get I'm going to get my stethoscope ready. I'm going to palpitate your carotid arteries one at a time. Okay, so I'm just going to feel right here. Feels good. All right, so my patient's carotid pulses are equal and strong on both sides, and I did one at a time. Next, I'm going to use the bell of my stethoscope to auscultate his carotid arteries. Okay. Let me come over here. Perfect. I'm going to do the other one. Okay, so I auscultated his carotid arteries one at a time, and I heard his pulses, but I did not hear any swishing sounds, which would indicate a bruit. So we're good to go. I heard his pulses, and that's normal. Next, I'm going to assess his nails. Sorry, my hands I'm sweaty. I'm nervous. Okay, so I'm going to check for your nails, make sure there's no clubbing, nothing irregular, and also then palpitate for capillary refill. So normal cap refill is 2 to 3 seconds. So his nail beds look great. There's nothing, they're not blue or purple. There's no clubbing. Now I'm going to press down lightly. On one hand, okay, there's normal cap refill. It starts to get back to pink. It was white, and then it turns back to pink within 2 to 3 seconds, so that's normal. I'll do the other hand to make sure it's even. Perfect. All right. Sorry. And then next, I will do your radial pulses. So I'm going to just check his pulses one at a time. You can, I guess I'll go down a little. Radial pulse, one at a time. I'm just going to feel it. Okay. Making sure they could see. Okay, so my patient's radial pulses are equal and strong, one at a time. I did, okay, and then next, you're going to squeeze my fingers as strong as you can. Oh, perfect, okay. So my patient, his strength is good. You can let go now, thank you. His strength is equal and strong in both hands. All right. Then we are going to stand up for range of motion, but I don't think you need to stand up. So what you could do is roll your arms back and forth. There's one. Now I'm going to check for it to be equal. That's perfect. Are you feeling any, are you feeling hurt? No? Okay, great. Now you're going to circle your wrist to see if there's range of motion in your wrist. Okay, next. That's equal. Perfect. Can you touch your shoulders one at a time? Like, yeah, perfect. Very good. His range of motion looks good. Next, I will assess his upper extremity sensation. So you're just going to close your eyes. I'm going to touch you on your arm, and you just need to tell me where I'm touching, okay?
Okay.
Close your eyes. Wait, sorry, I'll go. Can you tell me where I touched you? Can you point to it? Okay, perfect. You can open your eyes. Next, I will inspect my patient's chest. So the normal chest should be 2-to-1 ratio. It needs to be, lateral diameter needs to be larger than the anterior posterior. So your lateral diameter is larger than your anterior posterior in a 2-to-1 ratio. So we're good. Next, I am going to inspect for your respirations. I'm going to be looking at the rate, rhythm, and depth of your respiration. So normal respiration rate is 12 to 20, which I had said earlier. And then the rhythm needs to be regular as well. And a depth, you don't want it to be too fast or too shallow. You just want it to be breathing, not labored or anything like that. So you look great there. Next, I'm going to auscultate all 5 lung lobes using the diaphragm of my stethoscope. So I'm going to be doing 4 on the front, 1 on each side, and then 4 on the back. So I got my stethoscope, and I'll do that now. So you're just going to breathe normally for me. Perfect. Here's 1. There we go. Okay, and I'm going to do 1 on each side. Deep breath. Perfect. Okay. Oh, you can just sit regularly. Sorry. Deep breath. Perfect. So I do not hear any crackles, no stridor, no wheezing. It doesn't sound like there's any fluid or mucus. And I'll just do the 4 on the back. Perfect. Very good. So I just auscultated all 5 lung lobes on my patient. There are 3 lobes on the right side. Please stop touching my camera, patient. There are 3 lobes on the right side and 2 on the left side because of the heart. Next, I'm going to inspect my patient's rhythm of the heart. So the normal heart rate is 60 to 100 beats per minute. And you want it to be a regular rhythm as well. So next I am going to, that was the inspecting the heart. Next I will auscultate the 5 areas of the heart. Using my stethoscope. So first, the aortic valve is the right second intercostal space on the sternum border. Just going to listen. This is the right second intercostal space. Perfect. I also hear that S2 is greater than S1 on the aortic valve. Next is the pulmonary valve, which is on the left second intercostal space on the sternum border, and S2 is also greater than S1. Perfect, I hear that. And then next is Erb's point, which is the third intercostal space on the sternum border, and S1 is equal to S2. Great, I hear that. Then the tricuspid area is the left fourth intercostal space near the sternum border, and S1 is greater than S2. Oh yeah, definitely I hear that. Okay, and then the mitral area is the left fifth intercostal space on the sternum border. S1 is also greater than S2. Perfect. Okay, so next what I'm going to do is listen to your apex, which is at the point of maximum impulse. Normal is 60 to 100, so I'm just going to come down here and listen again. Okay, great. And I don't know if I said, but the mitral area, the left fifth, it's the left fifth intercostal space at the midclavicular line, and S1 is also greater than S2. Okay, so everything looks good there. Next, I'm going to inspect your abdominum. So I should expect it to be rounded, flat, and even. And it definitely looks like that. Rounded, flat, and even, normal abdomen. Can you tell me when your last bowel movement was?
This morning.
Okay, perfect. That's great. Do you have any difficulties with urinary retention or any incontinence when you're sleeping or when you laugh or anything like that?
No, I don't pee when I laugh.
Okay, great. That's good. You never know. It's normal sometimes. Okay. Next, I'm going to... Next, I will listen to your bowel sounds. I will listen for 1 full minute in each of the 4 quadrants, and I should be hearing 5 to 30 sounds in each quadrant. Okay, so I'm going to go ahead and listen to that, starting in the lower quadrant and working my way around. Okay.
Do you mean to stand up?
I don't think I have to listen for 1 full minute. I'm not sure. I don't think so. Okay. But I would listen for 1 full minute in real life. Okay. Can they see you?
I think so.
Then I would go here. I would make sure to listen for 1 full minute in each of the 4 quadrants, and I should be hearing 5 to 30 sounds, but I don't have enough time. So I hope that is okay. I'm supposed to be done at 20 minutes.
How much more do you have?
A lot. I don't. Okay, so I would just go in the way that the bowel movements would go through the colon. Okay, you can have a seat. That's all great. Okay, next I'm going to lightly palpitate your abdomen. It should be soft. It shouldn't be tender, and there shouldn't be any masses. So I'll feel your stomach. I'll do that.
Sore.
Kind of hard. I would just lightly palpitate. You let me know if there's if it hurts at all. I don't feel anything. All right, and then I'm going to palpitate my, I'm done right there with you, my femoral arteries. So that would be right on my leg. Just like right here. Perfect, okay. Okay, so next I will inspect your toenails and check the capillary refill. The normal cap refill in toes is also 2 to 3 seconds. I could do that, I guess. Put your foot up here.
Oh gosh.
It's okay. So I have my patient's foot, and I would do it on both. I would just feel it, lightly do that. Great. So normal cap refill is 2 to 3 seconds, and it starts to return back to normal color. I would do it to the other foot as well. And at the same time, I'm inspecting his toenails. They look fine. There's nothing weird about them. And his cap refills are even on both feet. They turn back to normal pink color. So next I'm going to feel for your posterior tibial pulse on both feet as well as your pedal pulses. So they should be even on both legs. So I would feel his tibial pulse. So you can put your foot up here, I guess. That would be like right here. That's great. And then at the same time, I can go ahead and do his pedal pulse. Very great. So on this foot, it's strong. Next, I'll do it to make sure they're equal. So I'm going to feel for his tibial pulse. Great. And then pedal pulse. Okay, awesome. So my patient's pulses are strong and equal on both feet. Next, I will inspect for range of motion in my patient's hip, knee, and leg. So if you could just stand up, and then you're gonna just like you do your hip in a circular motion for range of motion. Perfect. And then you're going to do it on the other side. And then also, can you move your knee up and down? Perfect. Act like yes. That's awesome. And then rotate both your ankles for me in a circular motion. That's awesome. Next, you can have a seat. I'm going to assess your leg strength. That looks great, by the way. Sorry. I would be more personable, but there's a time limit, so I'm a little worried. Okay, so you can have a seat. So I'm going to assess your strength. So I'm going to put my palms on your knees. Knees.